It's a busy day at Northwick Park A&E.
This is your SA node, your sinoatrial node.
And over in Resus, senior staff nurse Lou is in full swing training mode.
I have Jocelyn with me, so she's a third-year student, so she's on her final year. As a nurse, one of our responsibility is to be a mentor for other student nurses, so that's what I'm doing for her at the moment. All right?
Yeah.
Okay. No worries. I think it's quite scary to, go into a place that you have no idea about. So I try to be friendly. I also try to assess their learning needs or what they want to learn and just, level their expectations. The heartbeat slows down. So that's what you see on your ECG, okay?
But the teacher may soon become the student once again, as Lou's recently applied for a new job away from Northwick Park.
It has been a dream for me to move to America ever since I was young. But it's only now that I'm able to do it because of my current experience in nursing.
Until news of his new job arrives, he's eager to put his wealth of knowledge and experience to good use.
What I like about teaching is there's an impact there. Teaching someone is, impactful on that person because it will either make or break their career, their escape rhythm. So that's why you see his heart rate is quite slow. Yeah?
Satisfied that Jocelyn's up to speed,
Right, hi.
he takes her to give his patient Tom a jab.
Yeah, so I'm gonna give you this injection. It's called Revaxis. Yeah, it will protect you from tetanus. Okay.
Well done.
With Lou as her teacher, Jocelyn will be an expert in no time.
Where is it? Where will you put it? Well done. All right. Okay. She's a bit nervous, I think. But it's a student thing. I try to make them calm. And there. Very. Hold on. Well done. I was in her shoes before, so I know how it feels. But she did well.
Good nursing advice is coming thick and fast today.
They're horrible colour. Being Northern Irish, I do like a potato, but those are rotten.
In triage, Heather's chosen topic is emergency medicine fashion.
If you spilled blood or anything on those, it would show up straight away.
I would say a good sense of humour is definitely the first qualification to be a nurse.
They're so bland. People should be exciting in the emergency department. We're here because we're fun and cool.
You've got to be able to be a little bit light-hearted because sometimes the work is really intense. So being able to take a step back and laugh at yourself as well as everything else that's going on is really important.
Especially as staff here know events can change in an instant. And a ringing red phone means an ambulance is en route with a patient.
Good afternoon. This is a staff announcement. We have an adult blue light to amber recess, ETA of 12 minutes. Thank you. So I have a 66-year-old gentleman who's coming in with a fall, so it's an adult trauma.
With little information, Lou needs to prepare for any eventuality.
Whenever a trauma call comes out, we always have to assume that the worst is coming. So the story goes wherein he fell from a 10-meter height and he has some ankle injury. So we have to get all the team together to sort out, whatever the problem will be until the patient comes in that room and we start doing our primary survey or our assessment. We'll sort him out. We can do this.
Six-year-old Steve is being rushed in by ambulance after falling off a ladder while doing some DIY at home.
This is Steve, he's 66, around 15:35 this afternoon. He's been up a ladder, approximately 10 foot in height, where the ladder has fallen underneath him and he's landed on his right ankle. Top to toe is literally just an isolated right ankle query dislocation. Next to kin, yeah, daughter is here in the waiting room, so wife is on the way. Steve, look after yourself, mate. Take care.
It's down to Dr. Afra to lead Lou and the rest of her team on the best course of action.
Being able to speak, I'm not really concerned about the airway. in terms of the respiratory stats,
97% on good.
he's maintaining good blood pressure. So the only fracture we can suspect is of the ankle, or there could be a dislocated ankle. You can just open it and have a look.
Yeah, let's broken it.
Okay, then I'll book an X-ray and we'll send him shortly.
It's down to Lou to make further checks and confirm how badly Steve's foot and leg could be.
Okay, so Steve, what happened today?
I was looking into having solar panels,
Okay,
and I decided I'd go up on the roof to see how many solar panels I could fit on it. And I put the ladder up against the top, and as I got to the top, the ladder just decided it's going to come down.
Almost every day or whenever I'm on shift, there's always 1, 2, or 3 patients coming in because of like DIY injuries. So you fell down the ladder.
Fell down
And
the
then how
ladder.
high was that?
Think of a single-story house. I was at the guttering.
Okay.
My head was at the guttering.
Alright. Did you land feet first or head?
I think I landed probably my foot first.
Did you lose consciousness?
No.
Any vomiting after?
No.
No? Alright. But then, you know, accidents do happen every day, so that's expected, especially here in A&E. Right now, as you speak, do you have any pain aside from your ankle at the moment?
None at all.
None at all. Okay. I think the morphine's just doing its great job,
probably
isn't it?
Yeah. Probably is, yeah.
So the plan next is you will definitely have an X-ray of your foot.
Yep.
And they will decide on your CT scan as well.
That's my daughter's wedding in 6 weeks.
Oh my.
Yes, sod's law.
As some injuries aren't always clear on first sight, the scans are the best way to determine if Steve has any chance of being back on his feet for his daughter's wedding.
Sometimes some trauma patients come in and they're like that, but they're a ticking time bomb. You'll never know until you get the scan and you get proper X-rays. Then you will see that, oh my God, something's going on. Yeah.
So with a possibility of multiple fractures to Steve's leg and other elusive internal injuries, there's no time to waste.
Hi, this is Lou. I'm calling from A&E Amber Reeses. I just want to ask if you're ready for our patient to go there for his X-rays. Thank you so much. So does he need to wait? I'll take him for an X-ray now. We don't know, maybe he looks okay, but sometimes there are things that we might not see during a primary survey. So we have to wait until a scan is done.
I'm gonna do a few X-rays for you, okay?
Yeah.
Okay. We'll just lift your leg up. We'll fix your leg, don't worry.
Do you want me to try? Are you reading the right one?
Yeah.
Healthcare assistant Jade is in the ambulance arrival area.
Mahesh, yeah?
Yeah, I ringed on my head.
Did it ring?
No one in my family has done anything like this before, worked in healthcare. Everyone's kind of into beauty or construction work. So 4 years ago now, my mum got diagnosed with cancer. Me and my brothers and my sister, we all sort of cared for her. So that's kind of how I got into wanting to work in the hospital, because I saw all the different teams and things. I just saw what an amazing job they were doing. And I thought that was something that I would love to do, just to be there to support people and help people.
Done?
Yeah, done.
Sorted. All done.
But I feel like it's given me a lot more strength, and I've got a lot of empathy for people in work. So seeing the families and things, I feel like it's made me better at my job.
So if you could just take your jacket off for me. That's it. What did you come in with today?
Throw up.
Oh, you were sick yesterday.
Today, Arvinda has come in after a bout of sickness.
Have you been waiting long?
Yes, it's 11:15.
Oh, long wait today. And you could have been sat in your garden.
That's it.
My role in A&E is to help the nurses make their job easier.
Do you live alone?
No, me and my husband.
You and your husband.
I do think having people skills is a major part of the job. You need to be able to talk to different people from different backgrounds.
Grandkids?
Yes, 4.
You've got 4 boys and girls, or
1 gallon 3 pounds.
Oh, that's nice. There we go. If you just stay still for me.
Sure.
Have you had bloods taken yet?
Yeah.
Yeah? Okay. So the doctor should be next to call you once they've got all your results. Hopefully you're not here much longer and you can enjoy the afternoon.
Yes.
Evening, shall I say?
Yes. Can I go?
Yeah, all done.
Thank you. Okay.
Thank you very much.
Thank you.
66-year-old Steve fell off a ladder while working at home.
That's it.
Senior staff nurse Lou has taken him for an X-ray on the injured ankle.
It's broken in different areas, so it's a bad one.
Yeah.
The radiologist will read it right away, and then they will report it to the orthopedic doctors as well.
All finished.
Thank you. Well done.
Thank you.
Thank you. Thank you.
With Lou suspecting the X-ray will reveal multiple fractures in Steve's leg,
We'll go for a quick scan, okay?
the next course of action is to confirm with a CT scan if Steve has any other unseen internal injuries.
The best thing that we can do for the patient is to have a CT scan. So they will go through a scan of their head and their spine. It will give us an overview of what's really happening inside. All right, sir, we're all done now. Yeah. We'll go back to the room.
While Steve is returned to the unit,
Yeah.
Dr. Afra has received the results of his X-ray.
Can you have a look at the X-ray, please? She's like comminuted.
Yeah. There's a fracture of the distal limb of the tibia.
Maybe he fell like feet first, right?
It looks like a complicated fracture, so orthopedics will need to take a look. But in the meantime,
Hi. Hi, I'm one of the nurses. So
Lou swiftly updates Steve's anxious wife Pauline and daughter Laura.
he's still on block, so he's still immobilized. We're just waiting for the report of the CT to come back. And if it's fine, then we'll take it off and then he can sit up. We need to make sure the relatives are informed. They know what's happening to the patient, how the patient is doing, which is very important. Is it your wedding in 6 weeks' time?
Yeah.
Yeah. No dancing though.
Oh dear.
But at least he'll be there.
Best, actually.
I guess once they know that the patient is doing well, they get a bit more comfortable. They get less anxious about the whole situation. Okay, you ready?
Okay, yeah.
Thank you. Just take it inside. I've got your wife and daughter here, okay?
Yeah.
Steve will need to stay in head blocks until the CT scan results clear him from any spine or neck injuries.
No more going up ladders. Promise. Promise?
It's the drugs. I will be on crutches,
Yes, yeah, I know. We're going to have
and I
to...
won't be on crutches, hopefully, for your wedding.
Really?
But I can't dance.
Oh, no.
Oh, no.
Probably for the best, let's be honest.
No, fair enough. But, shock.
You know that you're going to be in deep trouble over it, but only when you're better.
Yeah, you have to wait. You think this is going to be the worst of it. You probably
Yeah.
wait till the constant digs for the next 6 months.
Yeah.
Especially because she's going to be driving you everywhere for how long?
You better speak up, because I'm going deaf.
Selective hearing, is it?
Yeah.
As well as making patients feel at ease, Jade's role as an HCA is to take bloods.
But we go to Malta every year with all my family. There's loads of us going this year.
Kaushik has come in with chest pains and is concerned he won't be able to go on his holiday at the weekend.
If I have a problem with my heart, I can't travel. So it is up to them to tell me if I can or cannot. I have gone through a triple bypass before.
Have you taken anything
In Thompson?
for pain relief?
No.
No? That's good. Okay, so you're going to feel a sharp scratch, okay?
Yeah.
Although Kaushik feels better now, Jade has to run blood tests to check he hasn't suffered any kind of heart attack.
Been lucky today. First time every time I've taken bloods. I haven't had to try again. Have you had anything to eat today?
I had my breakfast in the morning.
Yeah, did you want me to grab you anything? Cup of tea? Sandwich? You've come in at that awkward time in between lunch and I could imagine you was waiting for the ambulance for a while. I'd just like to try and take the patient's mind off the situation they're in, because obviously your brain will go on overload thinking the worst, and you just don't want them to feel like that. You want to calm them down. Just pop your finger on there. That's it, and I'm going to put some tape on. How old are your children?
Oh, they're both married. They have their children of their own.
Oh, so you've got grandkids?
Yeah.
They're very chatty and they talk about their family, their grandkids, and because I'm quite family orientated, it's lovely to hear.
They're there, the four of them.
I'm really close to my family. I spend a lot of time with my sister, my brothers, my cousins, my nieces. We're really close. I think if your grandparents were in hospital, you'd want someone to spend some time with them.
4 to 8.
4 to 8. Oh, do they get on or do they?
Oh, they get on very
Oh, that's good.
Like on Sunday.
Yeah.
They're going on a holiday.
Well, let's hope we get you out today so you can look forward to your holiday. Cheers.
Because of my
Okay.
sepsis.
For Kaushik, this is not the first time he's been at Northwick Park.
I was admitted here in October 2021. Fantastic the way they look after me, the way they treated me.
We don't always get that thank you because we don't really get a patient that comes back. Having that thank you is just really nice for us to hear, to know that we're actually doing our job properly. So it is good, yeah. Hopefully I look after you as good as they did last time. Just to have him sit there and say thank you and all his family be just so grateful for what you do, it is so rewarding to know that the job that you're doing is, people are just grateful for what you're doing. You want tea or coffee?
Coffee.
Coffee?
But only half a cup.
Yep, okay. I will go have a look and I'll bring it to you now.
Thank you so much.
You are welcome. So Kaushik he's going to have some more scans, an echo scan, and then he'll be staying in overnight. Hopefully Friday he'll know if he can go on his holiday. It's just the best part, just knowing how rewarding it is to see how much you've helped each patient through the process.
It's broken in different areas, so it's a bad one.
Senior staff nurse Lou and Dr. Afra have been caring for Steve, who was brought in after falling from his ladder.
There's a fracture of the distal end of the tibia.
After having an X-ray and CT scan, Steve's results are in. The good news is the CT has confirmed no other internal injuries.
Thank you.
And the team need only work on the fractured ankle, which now looks to be more complicated than doctors first thought.
So Steve has got right ankle fracture, and there are high chances of arterial damage. The nerves can be damaged as well.
And it's down to Dr. Patrick from Orthopaedics to deliver the bad news.
Hi, sir. Hello. I'm one of the doctors here for the orthopedics. Tell me, how are you feeling, sir?
I'm in lots of pain.
Still in lots of pain?
Coming and going, but coming more and more.
Okay. You've broken the ankle quite severely, hey?
Oh, no. How severely?
Very severely. And we need to operate, okay? Put some plates in there to strengthen it.
All right. For how long?
Okay. So you'll probably be on crutches for at least 6 weeks.
That's my daughter's waiting in 6 weeks.
6 weeks you'll be walking. I mean,
good.
You won't be dancing,
that's
but
not
you'll
a
be
bad
walking.
thing. Yeah.
That's reassuring. Thank you.
Sorry about that.
Okay.
So we're going to give you...
Due to the potential damage to the nerves and arteries in Steve's foot, he will now be transferred to a hospital in West London for surgery and specialist care.
All right, sir. What I do is I take these off.
So we got more medications for you. There you go.
When was the last time you ate?
Probably about half past 1.
In terms of pain, how are you feeling? Like on a score of 0 to 10, how would you rate your pain?
Yeah, it's the medication that I gave, so it's working.
Despite the complications, as the team gets Steve ready for transport, he seems to be in good spirits.
Everybody since I've been here has been wonderful. Done up like a dog's dinner, but all my own fault.
I was just thinking you're going to have lifts everywhere. Oh, I can't wait
trouble is I'm such a bad driver. You're going to have to shut up in the passenger seat.
Oh, I
and
can't
not
do
say
that.
anything.
I can't do that.
Mum will be the one escaping to us, not you.
If your pain gets worse, just let us know. We'll get you something for it.
Thank
All right.
you so much.
No worries.
Thank you.
No worries, you're all welcome. Okay, sir. All the best.
Yeah, thanks.
No worries. Get well soon.
Bye.
Thank you. Lovely. That's how I like it.
Healthcare assistant Tamsin is on a break and looking for her friend and fellow HCA Jade.
Hi, you right? Yeah. What kind of scare?
Jade actually lives near me. She knows like a few of my friends. So yeah, she's one of my good friends as well. I love Jade.
So what's going on then?
Me and Tamsin, we didn't actually speak for a while because we was always on different shifts. And then I saw her on a night out.
And then we had a little chat and she was like, I'm sure I saw you when we went out. And I was like, what do you mean?
And we didn't actually speak to each other on the night out. And then when we was at work, I said,
she's like, I saw you in the pub. And I went, what? And then she was like, yeah, you were quite drunk. And she was like, yeah, I didn't want to say anything because you didn't recognise me.
And then since then, we're literally like, as soon as we're together, we're inseparable. We're like gossiping away.
So I've got another parking ticket.
Another one?
My fifth one.
Only you.
So I park like round the back and then have to walk through the park. So I was running late this morning and I forgot to put the ticket on my phone. I don't want to cry.
Tamsin has a solution for keen equestrian Jade.
In the morning, ride the horse in.
Right outside of a hay net. Petrol prices these days, I will be.
I have 2 horses, Faye and Rocky.
Would you ever ride your horse in?
No, I wouldn't ride my horse today.
Why not?
One, it's too far.
Is there not a stables like nearby where you could put the horse
There's
in?
actually a stables opposite. I reckon it'd be cheaper to pay for that for the day.
There you go.
Everyone would be going out there.
We can go out and feed it at lunchtime.
I've had horses since I was 17.
You want to come to the stables, don't you?
Yeah, I've told you this before.
It's a perfect combination with my job because there's so much stress and so much thought going into your work, whereas when you go down there, you can just chill out.
Yeah, you can come around my one. You can go all through Black Park, Stoke Common.
What, on the horse?
Yeah.
Really?
I go through Black Park all the time. I'm off next weekend.
I'm off next weekend.
I'll pick you up and we'll go to the stables on Sunday.
All right then.
Don't let me down with a hangover.
Okay, that's a deal. I'll see you Sunday.
Go on, try on.
I will try.
These are results, yeah? 37.9, wasn't it?
Down in Resus, it's as busy as ever.
And Resus 3 is for medical bed. Who have we moved to here?
But senior staff nurse Ellie is used to juggling patients and beds and takes it all in her stride.
Hello, Northwick. Can I just ask why this isn't going to Harefield? A&E is amazing. I think when people think about A&E, they think, oh my God, it's stressful, it's really busy.
Is it blue light?
It's all of those things. Resus 4 is empty, Resus 3 is our surgical one, Resus 2. You treat people who really, really need help. I like that. I like being challenged.
Some stuff ready,
As
Sarah,
decisive as Ellie may be at the hospital, today she's being challenged in a whole different way.
I've got running a Resus down to a T now. Organising wedding is the first time for me. So it's way more stressful. We are 90% finished, all the planning, and we've selected our venue. There's going to be about 90 people during the day. And then everyone's invited from work after, so we'll see who turns up.
And with just 2 weeks to go to the big day, Ellie's hoping to tick off those final details with some much-needed help.
Hello.
How are you?
I'm good. How are you?
Good, thank you.
Nice to see you. I've got an amazing wedding coordinator, Sally. Where do you want to go?
Let's talk weddings.
Yes. She is helping me get through all the stressful bits.
So today's our final planning session, and we'll just go through everything that we need to go through before your big day.
Yes, I'm so excited.
So this will be your main wedding ceremony room. So where we're sat now, you'll have the registrar's tables, and then obviously we have the Chevalier chairs each side. We reserve the first 2 rows for your family.
Lovely.
And for your bridesmaids and flower girls as
Perfect.
well.
I love the traditional element of a wedding. My stepdad George is going to give me away. We're going to exchange rings, and then we'll go into full party mode after that.
And then obviously I'm with you to help you, bring you in to
keep us all on time.
Yes, to keep you all on time. We don't mind being a little bit late. We'll make Shane wait a little bit.
I will not be looking at anyone when I'm walking down the aisle. I'm going to be so nervous that I'm going to look straight ahead of me at Shane, hope that I don't trip up, get to the end and sigh with relief. But I do think there might be a few tears from people that I wouldn't expect. This is where I'll be saying I do if I turn up. No, I'm joking.
She'll be turning up, don't you worry about that. Don't you worry.
It's a bit surreal, actually, because the next time I come here will be my day. I can't wait to see it all done. I'm just so excited.
Is there anything that's playing on your mind at the moment?
I don't think so. I think you've literally sorted everything. Everything's how we want it, so it's been really exciting, but just paying for it's the hard bit. I'm really, really looking forward to my wedding, sharing that day with Shane, but also having everybody there that we love.
Back at the hospital, senior sister Heather is sharing her day with a wet flannel in the plaster room of the RAU.
So all this plaster is left by all the doctors, and then the nurses have to come along and clean up everything. Usually, to be fair, some nurses do plaster as well. I plaster, but I don't leave this mess. That's because I know I'll be cleaning it up anyway.
Don't speak too quickly, as 74-year-old Julie has been rushed in after tripping and falling on her wrist while taking in the washing.
I fell in the garden running. Well, I wasn't running. I never run anywhere. I was just going to kick in the washing.
An X-ray has already confirmed that Julie has suffered a fracture and her arm needs realigning immediately.
Most people, when they fall, put their hands out, but when you're elderly, you can break bones quicker or they can go into a bad position. The longer you leave a bone not in place, then the harder it is to put back. Because of the way the fracture is, we have to pull it slightly so that the bones align, and then we're going to be putting the plaster around. So I'm just preparing all the things so that once we've pulled the arm, we can put the plaster on quickly, basically. That's the idea. If you get any on your clothes, not to worry, it will come out in the wash, but just in case. So this bit is the sore bit, because it's going to pop the needle in to put the anaesthetic, OK? Might sting a little bit, all right?
OK.
It's horrible. I feel really sorry for them. They have to have an injection into the fracture of local anaesthetic. It can be really painful.
But Heather is well versed in distraction.
What vegetables do you grow?
Beans,
lovely.
tomatoes, cucumbers. My husband's very good at gardening.
Ah,
He's got green fingers.
He's the green fingers. Yeah, the husband's going to have to do all the dishes this week, I reckon, isn't it? You go home, you tell him strict instructions. You smashed that.
Thank you.
For the joint to heal properly, the bones need to be manipulated back into place.
Maybe Claudine can stand. Why don't you stand outside and then you can chat to her?
Okay? Yeah, fine. I'm fine.
You all right?
I'm fine.
Ready?
Ready?
Power woman.
You can do this.
A painful procedure, but one Julie doesn't seem to be fazed by.
Are you always working in A&E or you change?
In general, older women are very, very strong, hardened. They're like, oh, just get on with it. And you're thinking, what?
Squeeze my hand tight. That's fine.
What did you do back in the day?
My husband and I worked in the garment industry. We made buttons, for the dressmaking industry.
Okay. You can squeeze my hand if you want. That's fine.
She's got hands of steel.
With Julie's broken bones pulled back into place, her arm is now ready to be plastered. but only an X-ray can confirm that everything has been perfectly realigned.
We're just throwing plaster in that water, so don't drink that water. Gonna make it look neat. This is how you know if a doctor's done it or a nurse has done it, whether it looks neat or not. Just gonna hold it for a second while the plaster sets, okay? It's the hard bit done. You smashed it! You didn't swear once!
Yeah, I didn't shout.
Pulling a bone into place is sore. It's definitely sore. Hopefully that is good enough.
It's now a wait for the plaster on Julie's arm to harden before an X-ray determines if the realignment has worked.
So what we need to do is re-X-ray it to make sure it looks better.
Yes. What now?
Yes.
Out in the wilds of Greater London, Tamsin is spending her day off at Jade's stables.
Come here.
Oh, he's gonna be your new friend.
You work such long hours, but you always need to make sure that you spend time with your family and friends. So when I'm out of work, I spend time down the stables. It's nice to let your hair down.
Come here. Come. Slightly's a bit nervous of me. That is what happens in my life. Every single boy that comes near me. Kiss me. No.
Tamsin is hilarious. I feel like she has no filter, but she's just so kind and loving. She's such a good girl.
They give them bread.
Ruffin.
Put your hands flat.
Why?
Put your thumb in. That's it. So that he doesn't
Oh no,
bite
I
you.
don't know about this. Come here, Ruff.
There you go.
With the boy now eaten out of her hand, Tamsin's ready for her first ever ride in the saddle.
I'm excited. Obviously never ridden before, so a little bit nervous. I think the more worrying part of it is getting on it. Once you're on, you're all right. But it's the getting on part. I think I'm more worried about that. Oh my God, he's massive.
The famous Rocky.
Is it a boy or a girl?
Boy.
Hello. Oh, Jade, he's lovely.
Yeah. Just let your hair down. Put my stuff on.
Horses are like my outlet. It's like my little therapy. So I'll go down there. You've got no worries down there. No one judges you down there, and it's just perfect.
Oh, I'm scared. I ain't gonna lie.
Don't say that.
Time for Tamsin to get on her high horse.
Yeah. Right? And you've got to put this foot in this stirrup. Wait a minute, I'm going to hold this stirrup. You've got to bring that leg round to me.
Oh, I'm scared. Right.
Go on. That's it. Get your leg over.
Right.
Put your foot in there.
Oh my God. No, Jade, don't like it.
What do you mean you don't like it?
It's very high up.
We haven't even moved yet.
I'm honestly, I'm scared.
I thought you were
really
going to love it. You'll be fine in a minute.
Right.
Once you get used to it, you'll be fine. Honestly, that's it. Ready?
Jade, oh, don't like it.
Good boy.
I'm gonna come off. Jade, stop, I'm gonna come off. I'm gonna come off.
You all right? Sit up tall, hold on. Right, so I'm going to give you some instructions to do for when you're riding. So to make them go, you've got to give them a kick, just like a little kick. So kick him. That's it. So every now and then you've got to squeeze, 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 squeeze in, squeeze in,
squeeze in.
That's it. Well done, Tamsin.
Looks like Tamsin's got into her stride.
Because a lot of
Jade,
people,
I love it.
Are you living your best life up there?
I'm absolutely loving it. I feel like a new woman. This is going to be my new thing. Just you wait till I tell my mother. I did it! Oh, I love you. Come in. I loved it. It was a bit nerve-wracking at first, but once you get going, it is really exciting. It's really lovely.
Back at Northwick Park Hospital, in the RAU.
Oh no. What's that line on Richie? So all night long.
Senior sister Heather is treating 74-year-old Julie, who's had her fractured wrist manipulated back into place and set in plaster.
Fingers crossed.
Julie's x-rays will reveal if the realignment has worked.
Hopefully we've done a good enough job to get her home.
But it isn't good news. The bones haven't been pulled straight enough and the joint may not heal properly.
It can be really hard to get the bones into position because not only do you have to get it in position, then you have to plaster it in that position. If the patient even moves slightly or if we move it slightly, then sometimes it doesn't look 100%.
So Heather and the team need to realign the wrist again.
Sorry. My nice neat plaster, innit?
You've got to take it off and then do it again.
Yeah.
Can be quite
Look, she was all ready
upsetting
to
for the
go.
patient, particularly if it's been painful. She'd already put her coat on.
All right. It's just where the bone is sitting here is just a little bit impacted. He's not happy with how it might heal there. It might give you some reduced movement on the hand.
So it's off with the old and on with the new challenge.
You're not pulling it that hard, you know, you're not...
I am.
It's putting all his weight in it. I think a lot of people think, oh, it's just as simple as, oh, quick, but you're pulling a bone into place. It takes a lot of strength.
Nice cocktail. I wouldn't say it's quite on the same level as mine.
With the second manipulation complete, it's up to another X-ray to confirm that Julie's arm is realigned.
So it's not a ski whiff off this way. It's a bit straighter down here, which is what we want. So it looks much more like a normal hand should look. Yeah, I think we've done it this time. It looks much better.
Good.
Don't put your coat on yet. I think that's what jinxed us the first time, isn't it? That coat.
Although relieved the second manipulation has worked, there's another problem for the team.
The wedding ring was all right, but the engagement, yeah.
The fracture has caused Julie's fingers to swell around her engagement ring, and the team are anxious to get it off.
If it swells up further, it could cut off the circulation to the finger. And obviously we don't want that. You don't want to try with a bit of... Do you want to cut it? You don't want to try with a bit of...
No, it won't. No, it won't, because my mum was...
Oh.
2 weeks out from her big day, and with her wedding list all in check,
cheers.
Bride-to-be Ellie is meeting up with fiancé Shane for a little taster of things to come.
Happy wedding tasting.
Happy wedding tasting.
And as a chef, this is one area of wedding prep he can really get stuck into.
I am so excited about this because this is what it's going to be like on the day.
It's going to be a good day.
Yeah, and everyone's going to be around us, and I just think it's really exciting.
First to wet their taste buds is pan-fried chicken and roast sirloin of beef.
Superb, thank you. That looks beautiful. I don't know where to start.
Okay, first taste of our wedding menu.
Oh, this is so good.
The food element of things is quite difficult. From my perspective, I want everyone to have a really good day. So we're going to try and choose something that's going to be generally liked by most people.
Thankfully, the tasting is going better than Shane's proposal did.
It's a bit of a funny story. I went down to my nan's house for the weekend and he texted me saying, oh, why don't we go to the pub this evening? And I was like, yeah, no problem. And then my nan was like, I think we should have a roast dinner. So I ditched him for a roast dinner.
I said, if she'd have burnt your dinner, you'd have come home quicker.
Blame me.
Done my whole romantic proposal, and then you came out in your pyjamas.
I didn't know he was going to propose, so missed the pub. So he proposed in the front room, in the living room. I didn't know you were going to propose, so ruined all of his plans, and he's never going to let me forget it.
But how was the roast?
The roast was amazing, always top notch.
So, how are you feeling about taking time off work?
It's going to be weird to not be at work, I think. I have put a lot into work and into my job. So sometimes I forget about me a little bit. We'll have a whole month together, chilling, spending time with you, resting, going on our honeymoon. I'm really looking forward to my days off. You'll be sick of me.
That's true.
To make sure it all goes off without a glitch, Ellie's appointed BFF and senior nurse Nikita as chief bridesmaid.
Nikita, she is the most organised person in the world.
Nikita's been instrumental in helping Ellie plan the big day.
She would know what I loved and she would make sure that everything was going perfectly.
Well, if Nikita doesn't ensure perfection, the cheesecake and profiterole dessert certainly will.
Nice.
So by the time we're eating dessert, how do you think you're going to be feeling?
So I've married you, my best friend, and I've got the speech out of the way so I can enjoy my food. Can't wait to marry you.
Can't wait to marry you either.
If it swells up further, it could cut off the circulation to the finger, and obviously we don't want that.
Back in the RAU, Senior Sister Heather is working hard to save wedding memories for her patient Julie.
Do you want to cut it? You don't want to try with a bit of...
No, it won't. No, it won't.
Having come in with a fractured wrist, the team successfully manipulated the bones back into place.
So it's not a ski whiff off this way. It's a bit straighter down here, which is what we want.
But Heather is now worried the swelling around Julie's engagement ring could stop the circulation to the finger.
Is that hurting?
No. I was just sort of feeling that it was coming off.
Before the team resort to cutting off Julie's ring, Senior Nurse Andy has an idea.
So it's getting stuck on that side there.
Involving some paraffin and a little gauze.
It's nearly off. It's nearly off. It's nearly off.
I think it's nearly off. I think.
Okay.
I think it's past the bone now. Look here.
Yeah. I think it's coming. It's coming.
Yay!
Receive the ring!
Silly ring.
What about the other one?
Be what a hero.
Look at that. What about the other one?
Oh, that's made me very happy. Now you can escape.
Really?
Yes, now you can actually escape.
We actually can go now.
Yes.
All the best. Thank you.
With Julie's engagement ring and wrist intact, she's able to go home.
Felt like we were never going to get to the end there. She was definitely old school tough. She didn't barely batted an eyelid during the whole thing. Didn't scream, didn't shout. Take care, guys. Some people find it really, really hard, and she just took it all in her stride. Still chatting about her vegetable garden.
Dad.
Don't.
Suddenly this thing came, the heart problem.
Nowadays, you've got lots of men doing nursing as well, which is great.
Next time on Emergency Nurses.
In the toilet bowl,
my.
there was a baby.
Oh my.
We didn't know anything about that she's expecting. No signs of pregnancy, nothing like that.
He's got a very swollen neck.
So when I looked at him, I thought, yeah, he could lose his airway.
Hopefully, we strive to get the heartbeat back.
Wait, stop. Someone check the pulse. Thank you from the bottom of my heart.